space maintainer, there are different types. There are many types, in fact, but the most commonly used space maintainer is a band and loop space maintainer. The critical indication of using a space maintainer is the premature loss of teeth. So, whenever the premature loss of teeth is there, due to our need, we have to maintain the arch integrity here. So, arch integrity is to be maintained by a space maintainer. So, collectively, our aim is to keep sufficient space for the permanent successor to erupt into the arch in its normal anatomical position. That is what we are trying to accomplish here. So before doing a space maintenance, there are lots of entities are there. We have to do a study model, we have to do a model analysis, we have to find whether the patient is having any congenital deformities there. We have to assess the condition of the unerupted premolars, successor teeth, everything is there. After confirming that the proper indication is the need for space maintainer, then we have to proceed with the fabrication space maintainer. So when it comes to the fabrication of space maintainer, in this I would like to also quote about the model analysis. So the most common usually model analysis are Moyes, Tanaka Johnson, Hickson Hohlfather and Hakkaba analysis. These are analyses which are most commonly employed. So when confirming with the inference of this analysis, we are proceeding with the fabrication space maintainer. So on the fabrication, there are two processes here. The fabrication space maintainer includes clinical as well as lab procedure. So the procedures which I marked in red are the procedures which has to be done in the patient's oral cavity, whereas the procedures which I marked in blue are the procedures which will be done in the laboratory. So they are initial adaptation of the band material, first spot welding, initial approximation with hope layer, second spot welding, festooning and recontouring, crimping with beak plier, seam approximation, final adaptation and spot welding, final seating with the band pusher, impression taking, replacing the band and stabilizing it, cast pouring, wire bending and loop formation, stabilization of the loop to the band, soldering, quenching, trimming and polishing, and finally the placement and cementation of space maintainer in the required teeth. So all this procedures we are going to see in a video demonstration. So before that, we have to know the armamentarium used for space maintainers. So to my first one is the beak plier. So there are left and right beak plier which should be used in the desirable arches. So the main aim of the beak plier is for it is used for band pinching. Okay, also called as the final adaptation of the band. The second one is the wire cutter, which is used to cut 19 gauge stainless steel wire. Next, the band pusher, which is helpful for approximating the band to the anatomical position of the tooth. Next is the band removing plier, which is used to transport the band from the patient's mouth to the cast or the lab. Next is the contouring, which is used to contour the band in the desirable anatomical position. Next is the cast, which is used for demonstration of this entire procedure. Next is the spot welder, which is very important to fabricate the band. Next is the micromotor lab with handpiece. So the burr used here is called as greenstone burr, which is used to trim the band material, and it is very important for festooning and recontouring purpose. So here the first one is the band cutting scissor, which is used to cut the band material. Second one is the crimping plier. In certain condition, we need a fine adaptation of band to the tooth surface. In those conditions, we require this. Next is again a wire cutter. Next is a universal plier for a fabrication of a loop. So this is a silver solder. Along with this, there will be flux and which we use for soldering purpose. This is orthodontic touch, which is used to which aids in the soldering mechanisms. So this is the band material which we use. Then this is the stainless steel wire for loop formation. So by this audio visual demonstration, let us see how to fabricate a band and loop space maintainer. The first step here, what we are doing is we are taking the required amount of band material. We are cutting with the band cutting scissors. So sometimes it's difficult to cut. So after cutting, we are approximating the band. This is the initial spot welding to hold the band in a position. So after this initial spot welding is done, it's being done, sometimes the equipment, if it's not good, it will take more time. Yes, finally. Okay, so this is initial spot welding which is done to approximate the two seams of the band. So that is being placed in the tooth which is to be banded. So this video is taken by our mobile phone. Kindly cooperate. Kindly adjust. So he is just making a rough framework of the band. So he will make a rough adaptation of the band material into the tooth, on the tooth surface, around the tooth surface. So when this is done, he is using a hope layer for the initial adaptation of the band material to the tooth surface. So this is how it appears. When this is done, we have to do something called as festooning. So festooning is a process by which the mesial and a distal portion of the band should be beveled. Okay, this beveling helps the band to be seated properly into the tooth surface. So the greenstone burr is being used. One thing about the greenstone burr, we should not apply constant pressure over it. It is a slow cutting burr where heat won't be released very abruptly, but it has that wear and tear, because one burr you can use maximum for five procedures. That's all. So this is festooning. So mesial and distal portion of the teeth, the mad material which is going to cover that area is being festooned. So once this is done, just being done. So when this is done, off the micromotor, don't keep it running, and then you place it in the over the tooth surface. So now you see some more better adaptation. And one more thing, this is done in the cast, so we can't appreciate a perfect adaptation. In upcoming presentation or video, we are trying to incorporate this in the patient's mouth. Actually, we tried to do, since it is a COVID time, we didn't get the patient at the right time, so we did it in a lab with a model. So since it is done in a cast, more amount of festooning is done. Because in patient's mouth, no sulcus will be there, no. So the band will be entering into the gum area, the sulcus area, and adaptation will be established easily. So it will be difficult in case of the cast, when we do it in the cast. So I'll just move it quickly, I think. I'll try to fast forward the video. So it's adapting that. So this is the band pusher. This is used for adapting the band all over the tooth surface as per the occlusal inclines of the teeth. So since this is done in the cast, we are employing it in all directions, but when it is done in the patient mouth, it should be the force should be applied with the wrist, finger wrist, because unsupported force, when you apply pressure, it may slip and you may hurt the child. Dr. Selva Balaji is effectively giving you a demonstration. Okay. Yes, when this is done, again it is being done. Right, I'll try to fast forward it. So this is called as the band pinching, the final adaptation of the band material to the tooth surface, which will be done by this big player. So when this is done, you can see a very better adaptation of the band to the tooth surface. After doing this, you can do the final adaptation of the band material using the band pusher or band adapter, it's sometimes called as. So same step is going on. Since it is a cast, this trouble is there for us. If it is a patient mouth, it will be very easy. So in this cast, no, we can't approximate everything properly. So this is the final spot welding which has been done. So the final spot welding, we are approximating the exact shape of the band here. So this is cutting the seam. So the excess of the band material is called as a seam. So it will be cutting the seam. Next is a seam adaptation, which will be demonstrated for you. So there is a trimming, because any sharp things, protrusion, anything is there, it will hurt the child. So can you appreciate how the band is adapted to the teeth? Now is a seam adaptation. This is seam adaptation which is done with the hope layer. We have to move the protrusion to one side and we should adapt it with the band pusher. When this is done, we have to do a spot welding. So this concludes the fabrication of band, and we have to make sure that any sharp projections are there, and we should do the trimming work here. Once the trimming work is done, So the fabrication of the band is completed. So now we will be moving on to the fabrication of the loop. So yes, it's done. The band adaptation is done. So kindly see this. Yes. Now let's go for the formation of fabrication of the loop. The straight wire should be made and necessary markings should be done, because length of the loop varies from individual patients to patients, so it should be marked. And using a universal pair you can make a loop. So this is a fabrication of loop. So it should be in a position to hold the adjacent tooth which is present after adjacent tooth. That's an abutment tooth we can say. So this is how the position should be there. So excess of material can be cut, and hence the fabrication of the loop is done. So it should be made in such a way that the either side of the loop should fall in the middle of the band in the labial and the lingual portion of the tooth, portion of the band. Sorry. So once this is done, yes, approximation is done, and a slight contour should be given in the loop to maintain the anatomical inclines of the gingiva. See, you can see that incline here. So now the position of the band, the loop to rest on the band is marked, and it has been cut, and finally it is done. So once this is done, our next step is the stabilization of the loop to the band material. So this is done primarily by fixing wax. Then there should be rigid fixation, which will be done by POP, the plaster of Paris, which will be poured on the loop area to stabilize it firmly. Yes, that has been done. And now coming to the soldering process. So this is the application of flux which you are seeing now. So application of flux, then you should heat up the flux little. Take the silver solder, place in that area. Heat silver flux along with the silver solder along with the flux. Since the flux is there, the silver solder flows into the area where you require soldering to happen. So when the soldering is done on both the sides of the loop, quenching is been done. So once quenching is done, the next procedure is the trimming and polishing. So trimming should be done to reduce the soldering surface over the band material. Then polishing should be done to the entire appliance. When band and space meter is completed, it should be sterilized before inserting or cementing that in the patient's mouth. So that completes the entire fabrication of a band and loop space maintainer. So